Hello and welcome back to Southern Union EMS's Toxicology lecture. This is part 6, in which we're going to cover drugs abused for sexual purposes, poisonous alcohols, and hydrocarbons. We're also going to quickly discuss common household items. There's so many different types of common household items that can be very attractive for especially a child to put in their mouth and to even ingest as far as colorful plants, sweet smelling cleaning products, things like that. As always, keep in mind that the Poison Center is an invaluable resource. You need to try to identify the substance involved no matter what, but there are situations where you might not be able to. Drugs that increase sexual gratification. Phosphodiesterase type 5 inhibitors, i.e. sildenafil, tadalafil, vardenafil, Cialis, Viagra. These are erectile dysfunction medications that are potent vasodilators. Unintentional toxic levels are usually the result of aggressive dosing to achieve maximum sexual performance. Elevated levels may produce hypotension, tachycardia, ischemic chest pain, tachydysrhythmias, prolonged priapism that often requires urologic evaluation. Typically, supportive care is usually all that is required for this type of overdose. Cocaine and other stimulant drugs, such as amphetamines and methamphetamines, are popular choices for people seeking a more intense sexual experience. Treatment for these types of overdoses is, as discussed previously, for stimulant abuse. You may have to administer a benzo if they are in a state of excited delirium or something like that. Be aware that stimulants may have been laced with another drug to intensify the patient's response. Another drug that increases sexual gratification is amyl nitrate, commonly on the street known as poppers, rush, and happy snaps. It's an organic nitrate drug that can be crushed and inhaled to produce an intense sexual experience. However, as mentioned in the previous lecture, use may cause methemoglobinemia, affecting the oxygen carrying ability of the blood and result in an associated ischemic effects. As with any nitrate, hypotension may result from blood pooling in the periphery owing to the vasodilatory effects of the drug. One of the most unique drugs in the group is MDMA, or ecstasy. It's an analog of methamphetamine, and it may have similar toxic effects on a smaller scale. The release of serotonin, a sensation of euphoria, and disinhibition are the effects associated with the use to enhance a person's sexual experience. Significant adverse effects, such as hyperthermia and electrolyte abnormalities, such as hyponatremia, may also result. Supportive care is appropriate during transport. Dextromethorphan is actually found over the counter in cough suppressants. It produces a mild stimulant effect that may enhance sexual experience, or large quantity consumption can cause the thing here, euphoria, psychedelic visions, things like that. GHB, also known as a date rape drug. GHB is gamma hydroxybutyrate. It's an endogenous metabolite of the gamma and butyric acid. It causes an intoxication similar to alcohol. Neuromodulator involved with sleep cycles, memory retention, and emotional control. It exerts its effects within 60 minutes. Oftentimes it's laced in drinks. It is essentially a drug for people to be able to exert themselves over other people because of the disinhibition, the severe passivity. Also, they have antegrade amnesia. They don't remember anything that's going on. Rohypnol, also known as roofies. This is a potent benzodiazepine. Too much of it can lead to respiratory depression or death. It's illegal to make or distribute. Of course, the other drugs used the way that we're talking about today, it's illegal for them to use that as well. Keep this in mind, especially in bars and gatherings. These are manufactured for are for industrial or non-gastronomic purposes, meaning they're not designed for you to drink. However, folks with alcoholism do resort to drinking alcohol that is not designed to be ingested. The first one, methyl alcohol, is wood alcohol, also known as methanol. It's present in paints, paint remover, windshield washer fluids, antifreezes, varnishes. Methanol itself is not harmful, but its breakdown products are formaldehyde and formic acid are responsible for methanol poisoning. Interesting enough, a dose of 60 to 250 milliliters in adults or 8 to 10 milliliters in children is associated with severe toxicity. Peak blood levels are attained within 90 minutes. In mild toxicity, the half-life is 14 to 20 hours, and it increases to 24 to 30 hours in severe cases. Oftentimes, with methyl alcohol, the symptoms appear 12 to 18 hours after ingestion, given the methyl alcohol time to actually be metabolized and broke down into its previous mentioned forms. Nausea, vomiting, headache, vertigo, abdominal pain, blurred vision. Your management for these types of patients, consider sodium bicarbonate. Activated charcoal is contraindicated in these situations. Administer glucose and thiamine per local protocol if the glucose levels are off. Morbidity and mortality are often driven by the amount ingested and the speed in which the patient receives definitive treatment. And if you associate the patient with methyl alcohol ingestion, you want to provide immediate transport. Ethylene glycol is a colorless, odorless liquid with a lethal dose as little as 150 milliliters. It's found in antifreeze, coolants, polishes, paints. It's similar to methanol and sometimes ingested in the absence of ethanol. Ethylene glycol is water soluble and it's absorbed rapidly when taken orally with peak blood levels within 4 hours. The livers and kidneys metabolize it into a number of toxic metabolites, and these are what actually hurt the body. Stage 1, soon after ingestion, you have CNS suppression and intoxicated appearance. 12 to 24 hours later, you have cardiopulmonary symptoms and possible hypocalcemia. 24 to 72 hours later, you start having renal damage or kidney issues. Your management care is the same for methanol poisoning, or you may be ordered to administer calcium gluconate for your patient. Hydrocarbons are structurally simple organic molecules comprised of only hydrogen and carbon. They're found in a variety of products in the home, including natural gas, cleaning agents, petroleum distillates, and fluorocarbons. 3 common methods for abusing hydrocarbons: huffing, sniffing, and bagging. There's a high abuse potential from those seeking a cheap buzz here. In hydrocarbon inhalation, products containing hydrocarbons are widely available, and it's often the route of exposure for users without access to or funds to purchase illicit drugs. Your treatment goals are going to be to remove the patient from the noxious environment, administer high concentration oxygen, and promptly transport to the appropriate facility. So with a patient that has been huffing, oftentimes they're huffing paint, and you will see paint residue around their face, and you'll smell the paint as well. A couple of the common compounds of hydrocarbons that are abused. You've got methylchloroform, trichloroethylene, which is degreasing solvent, aerosol propellants, tetrachloroethylene, methylene chloride, and carbon tetrachloride. And then your petroleum hydrocarbons, benzene, toluene, and gasoline. Gasoline toxicity is going to be sudden death. Shouldn't be really a surprise if you've huffed gasoline, though. The lower the viscosity, the higher the risk of aspiration will be. And so once you've aspirated as well, not just the fumes, but the actual physical fluid, then you're going to have even bigger problems. Even when stored appropriately in labeled containers, hydrocarbons may be mistakenly ingested by a child looking for a drink. Okay. Adult ingestion of hydrocarbons is likely intentional to cause self-harm. Low viscosity facilitates the uptake of hydrocarbon by tissues of the CNS and its anesthetic effects. Initial experience, excitement, and euphoria, followed by loss of fine motor skills, drowsiness, confusion, and coma. Cardiac dysrhythmias may also be present during monitoring. Many products cause gastric irritation, and just a single exposure may cause sudden death. Assessment and management, decontamination, airway, oxygen, vascular access, administer sequential infusions of normal saline while you're in the field. Hydrofluoric acid or hydrogen fluoride. Hydrofluoric acid is hydrogen fluoride that has been placed in an aqueous solution. It has a very low pH and causes devastating local and systemic toxicity and exposure to an extremely small amount. It's primarily used in industrial settings. The way it works, it leaches calcium and magnesium from the body tissues, which results in hypocalcemia and hypomagnesia. Then this leads to a massive release of sequestered potassium into the systemic circulation, which now in turn is going to cause hyperkalemia. Because of this, you have exposure because of the exposure, you have not only the physical effects of the chemical burns, but you also have dysrhythmias, tremors, and seizures. Inhalation causes throat discomfort, bronchospasm, stridor, airway injury, wheezes, crackles. Ingestion is going to cause profound systemic toxicity, hypocalcemia, other electrolyte imbalances, dysrhythmias, tetany from the hypocalcemia, muscle spasms, vasospasms, and acidemia. Assessment management, obviously, decontaminate. For ingestion, consider dilution with milk or water. Calcium gluconate may also be used. A paste of water-soluble lubricant and a 10% calcium gluconate mixture may be applied to local burns. And IV administration of 10% calcium gluconate may be allowed by local protocols or online medical control in the presence of cardiac irritability. Hydrogen sulfide, highly toxic colorless gas with a rotten egg odor. Poisoning usually occurs by inhalation. Affects all organs, but has the most impact on the lungs and the central nervous system. Low-level exposure can cause eye, nose, and throat irritation, headache, and bronchitis. Very high exposure, seizure, shock, and cardiopulmonary arrest. There's no antidote for hydrogen sulfide. Remove the patient from the contaminated area. Get them to the hospital. Oxides of nitrogen, nitric oxide, and nitrogen dioxide. These form as a byproduct of fuel combustion. It's colorless or brownish at room temperature with a sweet smell. Nitrogen dioxide, that was nitric oxide. Nitrogen dioxide is colorless or brownish with a harsh odor. Exposure may come from kerosene heaters in the home or from facilities that produce nitric acid. Irritation to the throat, upper respiratory tract, pulmonary edema, difficulty breathing, and weakness all may occur. In the event of exposure, remove the patient from the environment, provide supportive care, gain IV access, and be prepared to intubate. This concludes part 6 of the toxicology lecture series. You can reach out to me, Nick Ray, at suscc.edu. Thank you.